Hello dear friends and colleagues, in our previous video we have learnt about pterygo lens for pterygium surgery. Now let us see few other interesting indications of pterygo. Mini-scleral lenses are made of RGP material. Hybrid scleral lens is the one in which central optic is gas permeable RGP semi-soft and the peripheral skirt is soft, and a rigid scleral lens is the one which is lathe cut from PMMA. Rigid scleral lenses, which are back aspheric and the peripheral skirt matches the scleral curvature, whereas the central optics back curvature provides a nice volt, are best indicated for keratoconus because this tear film reservoir optically masks the irregular astigmatism and surface irregularities to a great extent, giving much better quality and quantity of vision to these patients. This optical masking of corneal irregularities we can see well in these slit lamp photos of pterygo lens in keratoconic eyes. Please notice the presence of fluorescein in tear film reservoir. This lens can be used even after intact ring segments implanted in corneal stroma. Even in such severe keratoconus, it masks the irregular astigmatism to a great extent and improves the vision quality. Even for the C3 or CXL, we use Pterygo BCL and it gives very good wow vision to the patient as soon as the surgery is over due to masking of irregular astigmatism. Also, for all our cases of mitomycin augmented PRK or for LASIK, we use this soft Pterygo as bandage contact lens. And for the same optical reasons, this lens also helps aged patients of multiple incisions RK done 2 to 3 decades ago. RK eyes in late age usually develop significant hyperopia due to central flattening with peripheral corneal bulging, most of the times with significant irregular astigmatism. Central flattening with peripheral bulging in these aged RK eyes is exactly the optical opposite of keratoconus, which can be best taken care of by the Pterygo BCL, rectifying hyperopia as well as much of the irregular astigmatism. Keratoconus or RK, in both cases optical action of this BCL remains the same, only the tear film reservoir geometry is inversed. These are also RK eyes with RGP lenses. Pellucid marginal degeneration is a clear and transparent non-inflammatory thinning of peripheral cornea, usually in the shape of a banana or a crescent, which gives this typical lobster claw or crab claw appearance on topography. The word pellucid is derived from two Latin words. Pel means thin and lucid means clear and transparent. This marginal degeneration is always a clear thinning and is always non-inflammatory in nature. By the way, this relationship is like a slide and a cover slip. It is interesting to note that cover slips are named as pellucid in some European languages. This is a pellucid stream, thin and transparent. And this is pellucid river. In contrast, the Terrian marginal degeneration is usually opacified and most often it is vascularized, which gives a big butterfly or a big moustache like appearance on topography. Murine ulcers are autoimmune and inflammatory in nature, but when they are healed, they and all such similar entities give rise to large irregular astigmatisms. They may need banana graft, but graft or not, all these patients can have very good vision by using this Pterygo BCL. We personally prefer to put this BCL immediately after the PKP or DALK right on table because it gives much faster epithelial healing, better visual outcome on post-op day 1, and it retains and delivers the topical eye drops drugs much better and longer. Pterygo is a great help also in all later post-op stages of PKP, taking care of high and irregular astigmatism. Pterygo is an excellent buster of any kind of irregular astigmatism, even in post-injury corneal scars with irregular refraction. These lenses can also be made in desired spherical powers. put a plano BCL in keratoconus or RK or corneal scar patient, then do trial refraction to find out the best accepted spherical refraction, and accordingly the powered Pterygo can be made at a little extra cost. Now let us understand the tear film reservoir between the cornea and the soft type Pterygo lens, which is having soft skirt and slightly firm center. Beg your pardon, just imagine a padded bra. When the patient blinks, the closing pressure exerted by eyelid muscles will press on the volt. So the fluid is partially squeezed out, and when the patient opens the eye, the volt recoils, and due to the resulting negative pressure, new fluid enters from the periphery. This dynamic fluid exchange keeps on happening with each blink during the day and even during the sleep due to REM movements. To a certain extent, this fluid dynamism can be observed in slit lamp examination by movements of drug powder particles by putting prednisolone or triamcinolone as eye drops. Theoretically, this may sound like it might give fluctuating vision, but the delta volume change of fluid reservoir is so small that practically it does not. In fact, it gives nice and stable vision. Because of such dynamic tear film, as well as very high water content and very hygroscopic nature of the material of this lens, it keeps the corneal epithelium always moist and well hydrated without any hypoxia or micronutrients deficiency. So this lens is also a great help in chronic and or recurrent filamentary keratitis. They heal well in few weeks to months. Pterygo BCL combined with C-neck eye drops with oral multivitamins and oral doxycycline regimen with topical soft steroids and a complete stopping of tobacco in any form, oral or smoking, will help to resolve the filaments much faster and much better. Also in severe or chronic recurrent epithelial erosions, mostly which are due to severe dry eyes, or in another class of recurrent epithelial erosions which are mostly incited and ignited by trivial trauma, mostly by fingernails or by paper or cardboard corners, they also heal so very well with Pterygo. In fact, this combination permanently removes the word recurrent from the recurrent erosions. Because of the dynamic tear film, high water content and the hygroscopic nature of this lens, for the corneal epithelium and limbal stem cell rim, there is no dry eye, although the conjunctiva and other surface area may be dry. Pterygo is also a superb therapeutic device for bullous keratopathy due to Fuchs, pseudophakia or herpes zoster. It gives excellent comfort and fairly good vision till patient's turn comes for PKP or endokeratoplasty. We have many patients who are using this BCL since long, and most of them have chosen not to go for corneal transplant of any type after tasting the benefits of this lens. Because of very high oxygen permeability and 80% water content, and also due to dynamic tear film reservoir, these lenses can be kept in situ 24/7 for 4 months continuously without any fear of corneal hypoxia and limbal pannus. Patient can come to eye surgeon's clinic once every 3 to 4 months to have a new lens. Because of the size, it is not easy for the patient to self-wear this lens. Eye doctor has to remove the old one and put the new one in the clinic. Because the diameter is large, fornix to fornix, this lens will not fall off during shower bathing or normal activities, even during sports. Only contraindication will be swimming and water sports without watertight swim goggles. This lens is also a great help for irregular corneal surface due to spheroidal corneal degeneration. Just cover the spheroidal surface with BCL without any scraping or without any intervention. Pterygo is also a great help and a protection, in fact a must for Boston K-Pro as well as for Oro K-Pro. Customized BCL based on topography can also be made. Of course, it is too expensive for most Indian patients at present. Painted and printed large BCLs also can be made not only for cosmetic or fancy purposes, but also for hiding corneal scars and masking the traumatic iris defects, and also for congenital or traumatic total aniridia. We always use Pterygo BCL for all our Gunderson flap surgeries. And yes, please don't worry about the air bubbles trapped under the BCL. They will burp out from 12 o'clock position when the patient sits up. The soft Pterygo works so well in upper or lower lid entropion, giving complete protection to cornea like a shield against arrows. Please try it. Also, in cases of trichiasis and dystrichiasis, your patients will be so happy with Pterygo. It is also a great help in exposure keratopathy in leg ophthalmos due to Bell's palsy, and also in cases of neurotrophic keratitis, and also in severe thyrotoxicosis. In all such cases, the Pterygo gives excellent protection, relief, and very satisfactory results. As general ophthalmologists, our knowledge about scleral lenses is limited, so we all should open our minds and hearts more for the variety of scleral lenses and also for other specialty lenses. Because we first have to learn to remove the L and to earn not only money and self-esteem, but love and respect from our patients. We have no financial interest in Pterygo lens. Mr. Gagan Sahni, a great knowledgeable person and an excellent educator, is the owner of Silver Line Laboratories, which is the company making these specialty lenses. He is very kind and always eager to inform and educate us on these technologies. He can even hold a full day CME on these lenses. Please contact Mr. Vikram Panchal for commercial availability of Pterygo. He can supply you all over India and he can also offer you the best price packages. Thank you very much for your kind attention and patient listening.